Denise, and I will be here with you today as a moderator of this virtual seminar organized by the OP, organized by PAHO here in reference to the status of drowning prevention and control in Latin America and the Caribbean. That is working on activities for the World Day of Drowning Prevention Day. Here we took for successful experiences and concrete actions to be able to reinforce the efforts in the region. We remind you that we have interpretation, simultaneous interpretation in English and Spanish, and you can choose the language of your preference in the icon of the world that is in the bottom part of the Zoom. I will now start sharing the agenda. If you can just give me 1 minute, please.
Vamos a compartir la agenda. ¿Pueden ver la agenda ahí?
Can you see the agenda, please? Now we are going to begin with a message of opening from the PAHO's director. Then we're going to see the current status of the prevention of drowning and control in the region of the Americas. Then we're going to see two successful stories that show the prevention, and then we will pass on to hear the tools developed by the WHO. And finally, we will begin with have a presentation of Commonwealth and some final words. To begin the seminar, I am going to share the words of a doctor, of the director. It is a pleasure to welcome you to this virtual seminar organized by PAHO in order to be able to present the analysis of the current situation in reference to the strategies of prevention of drowning in Latin America and the Caribbean. The resolutions that have been seen in reference to the General Assembly of the United Nations and is 76.18 of the World Assembly of Health, which will contribute to be able to see the prevention of drowningness as a world public health issue that is preventable. In reference to seeing around 17,000 people that die of drowning in the Americas, which is equivalent to 950,000 of lost healthy life. However, drownings can happen at any time during the life. They affect normally children and elderly people. Every life lost by drowning is not only a personal or family tragedy, but it is also a reminder, a constant reminder that the most solid and safe areas can actually have set the difference. Today's presentation regarding this prevention of drowning represents a very important step in reference to being able to see here this in the region, and they offer a general overview of all of the progress set with the countries. We are basically seeing the efforts and activities of awareness and prevention in the countries, and we're also able to identify key areas that require enforcement in reference to being able to see the planning on a world end. Now we will continue in English.
The World Health Organization, WHO, has outlined clear evidence-based measures that can guide our way forward, including strengthened multisectoral coordination mechanisms to ensure drowning is integrated into national policy agendas, improving data systems, implementing relevant legislation and enforcement, and installing barriers that control access to water to provide safe spaces for children. These are practical, proven actions that can be adapted to different national contexts. What they demand is continued leadership, cross-sectoral collaboration, and sustained engagement from all stakeholders across health, education, emergency response, civil protection, and communities. By building on these recommendations, countries in our region can move beyond isolated efforts to more coordinated and impactful drowning prevention strategies. This webinar is an opportunity to share progress and to inspire further action. Today, we are pleased to hear from colleagues in Brazil and Mexico who will present national experiences and good practices. We will also hear about the tools available from WHO to support countries to advance drowning prevention. May today mark the beginning of stronger collective action so that drowning prevention becomes a regional priority driven by evidence, collaboration, and shared commitment. Anyone can draw, no one should. Thank you.
Perfecto. Agradecemos al doctor Barbosa por su
Perfect. Thank you very much,
presentación.
Dr.
Ahora nos va a
Barbosa, for your
pasar
message.
con el
Now we are
primer
going to
ponente,
begin with our
Ricardo
first
Pérez Núñez,
speaker, Mr. Ricardo
representante
Perez
de las
Núñez, Regional
organizaciones no
Advisor
intencionales de la OPS,
in
quien
reference to
presentará
the
las
to PAHO, that is
características
going
de
to
las
present
alertas en la
the
región
status of
Pacífico.
prevention of drowning in
Adelante, doctor.
Latin America and the Caribbean. Go right
Muchas
ahead.
gracias
Thank
por
you very
acompañarnos en esta
much
actividad en la
for
que
being with
quisiera
us here in
compartir
this
con
activity. I
ustedes
would like to
la
share with
información más
you
reciente que
the
tenemos sobre
most
el estado
recent
de la
information
prevención
that
de
we have regarding
desbordamientos
the
en
status
nuestra
of
región.
prevention and drowning in our
Eh,
region.
Voy a dividir mi participación en
I'm
cuatro
going to divide
partes.
my participation in
Iniciaré
four
con algunos
parts. I will
antecedentes.
begin with some
A pesar
background
de
information.
décadas de trabajo
Although
impulsado
after
por
decades of
distintos
cross work by
profesionales y
different
organizaciones
professionals
de
and
prevención de desbordamientos fue
organizations, the
reconocida como una
prevention of
prioridad en la
drowning was
agenda
recognized as a
política global.
priority in the political global
Cuando en
agenda.
2021 los países
When
en
in
el
the year
marco de la Asamblea
2021, the
General de las
countries in
Naciones
the
Unidas
General
adoptaron
Assembly of
la
the United
resolución
Nations were able to adopt the resolution
75-273,
75
como nos
to
comentaba el doctor Yardas.
73 that was mentioned by
Y bueno,
Dr.
aprovechando
Yardas. And while taking a look at this
que se da a nivel global
effort that
gracias a
was
la
made
Asamblea Mundial de
globally,
la Salud,
here we are
también
seeing
adoptó
the
esta otra resolución
World Health
76.18
Assembly,
en
which also was able to see
2023, en la que los
76.18
países
in
acordaron acelerar la
2023, where the
acción
countries were able to see
mundial
that they
para
would
la prevención de
accelerate the action
ahogamientos
regarding the prevention of
mediante el
drowning
desarrollo de estrategias
worldwide through the development
multisectoriales
of strategies,
integrales
multiserial,
que insertarían dentro del proyecto
multi-sectorial
más
ones
amplio
that would have
posible de
more
prioridades del
strength
desarrollo. Y
mechanisms
a
in
través de
reference
estas
to opportunity and
resoluciones,
development.
los
And
países le
through
han
these
dado mandato a la
resolutions, the
Organización
countries
Mundial de
have
la
been
Salud
able to
y
give
a la Organización
the
Panamericana de la Salud
WHO and at
de
PAHO also
apoyarles
the
estimando
way
la
of being
magnitud y
able to help
características de
them
los
seeing the
ahogamientos,
different magnitude and characteristics of
también
drownings,
identificando y
and also by
compilando
being able
evidencias
to
sobre las
identify and
intervenciones
gathering
más
experiences
efectivas
regarding the
para
most effective
abordar las distintas
experiences to be able to see
problemáticas
the
que
different
puedan
problematics
identificar o que se han
and problems that
identificado
can
en
be
cada uno de los
identified or that have been
países
identified
y
in each one
buenas
of the
prácticas
countries,
sobre su
and best practices
implementación
in reference to the
exitosa.
implementation that is can be
También apoyar a los países
successful
en
to
la
also being
implementación
able
de
to provide
intervenciones
support in the countries in the
prioritarias según
interventions,
cada
priority
contexto,
interventions according to each
lo
one
que
of the
supone
contexts.
desarrollar una estrategia
Now, it
global y
leads us to
herramientas
be able to
técnicas
develop a
para
global
apoyar
strategy
este
and
trabajo
technical tools to
local.
be able to support this
Y también
local
apoyar en la
work,
definición de
and also to be
indicadores,
able to
metas
support
y la
the
medición
indicators
de
and the
su progreso.
measuring of its own
Y esto
progress.
lo hacemos
And this
a
is
través de
done
distintas vías. El
throughout
primer vía
different
es la
ways. The first
recopilación
way of doing this
sistemática de
is the
datos a nivel
systematic
mundial,
gathering
por
of data
ejemplo, para la estimación
worldwide,
de
for
la
example,
mortalidad
for the
general y
estimate of
específica.
this general and
Y en
specific
este sentido, con el
mortality.
fin de
And in this
facilitar el
case, in order to
análisis de la
be able
mortalidad
to
nacional y
facilitate the
regional,
analysis of a
la
regional
OPS ha
mortality and
creado
world
un
mortality,
enlace que
the
puede
PAHO has
accederse mediante
created
código
a
QR que
link that
les
you can have access
compartimos,
to this QR code that you see
y en
here,
el que
and
se puede
where
visualizar la
we are
mortalidad
able to
estimada
visualize
representada
the
por la
mortality
Organización
that's
Mundial de
been
la Salud
established
para
throughout the
distintos temas
World
en
Health
riesgos de
Organization for our different
desbordamientos.
topics, such as
Aquí se puede
drowning.
consultar
Here we are
distintos
able to also see
indicadores
different
según
indicators according in
edad y
reference to
sexo
being age
para el
group and
periodo 2000 a
different sex
2021, que es
groups
la
during the
cifra
period
más actual que se tiene disponible.
2021, which is the numbers
Y
that we
también
have
se pueden
here.
visualizar
And
las
also we are
tendencias y
able
hasta
to
descargar las
visualize
bases de
the
datos
trends and being able to
para
unload
nuestra
databases
referencia,
for a
un
better
análisis más específico que
and
quieran
more
realizar.
specific analysis that you want to be
Además de la
able to
recolección
analyze.
sistemática de
Also,
datos, se
the
llevaba a cabo
systematic
una
recollection,
evaluación
we've
de
also been able to
situaciones de
gather
riesgo de
out
ahogamientos que
the
culminó
current situation
con la
of drowning in the
publicación
country, which
de este primer
culminated with
informe
the publication
situacional
of
en
this
diciembre
first
de
situational
2021
report in December
que les pongo aquí en la
2021,
parte
which I
izquierda,
will put now here on the
que es la
left,
primera edición
which is the
del
first
informe mundial
edition
sobre el estado de
of
la
the
prevención de los
World
ahogamientos
Report
con
for
un
Prevention
código
and Control of
QR
Drowning with a
para
QR
fácil
code
acceso.
for its easy
Pero muy
access.
acertadamente me
And
parece, los
well,
colegas de la
I
Organización Mundial
believe
de la
that
Salud
the
también desarrollaron
colleagues
la
of
aplicación que pongo aquí en la
WHO
derecha,
were also able to see
en la
this
que se
here on
puede
the right,
acceder a
where we are able to
información
have
clave a
access and
nivel
reference to having
mundial,
key information
regional y nacional.
worldwide on a
Espero
regional
tengan la
end, which
oportunidad de
I believe you
descargarlo,
have
pero sobre todo
enough opportunity to be
esta
able to
información les resulte de
establish, but
utilidad
this
para el
information
importante
is able to
trabajo
be useful
que
for the
todos
very good
tenemos.
work that all of
Y es
us have.
precisamente el
And
análisis
it is precisely
regional de
here
esta
in the regional
información la que estaremos
analysis of this
presentando a
information, what we
continuación,
are presenting right here and
será
now, the same
publicada
one that will
próximamente en la
be
revista Epidemiology
published
y que
here
entre
in
tanto
the
les estaremos
journal, and
compartiendo
that
para su mejor
we
referencia.
would be
Este
able to
análisis
see this here in
incluye
reference
la
to a
información
more
recibida de
analysis.
26
This
países de la
gathers the
región
information we collected
que
of 26 countries of the region that participated in this efforts, and therefore it is not included in the analysis in reference to Vernacular Barbados, Haiti, Nicaragua, St. Kitts and Nevis, Santa Lucia, San Vicente, and the Grenadines, Trinidad and Tobago, and also Venezuela, which were member states had decided not to participate for this time. But we hope for them to be able to gather or join us in this global effort. It's quite unfortunate because the majority of them are Caribbean countries that are quite exposed to drowning. But I think this is something that we can start incorporating in the future. And now, passing on to the issue that we have, I think that here it's about the number of people that died in drownings throughout 2021 in the Americas, which was able to be seen here in reference to 70,000 people that died, drowned in the Americas throughout 2021. This generated a loss of healthy years of life of a little bit less than 1 million of years that were lost due to this cause. We do know that these drownings affect normally men and child population and elderly people population. And we will present the rates here in this slide for its best reference. And finally, to be able to say it's the seventh cause of death between a population of between 5 and 14 years of age. But what are the current progress and the current challenges? I will talk about three components now that are very much included in the analysis. First of all, the first part in reference to being able to establish here the general efforts in reference to being able to see this that has to do with drownings. Then we have the policies and legislations that have different levels to be able to prevent this from happening in reference to these events. And finally, interventions that are community interventions, which are key to be able to prevent and respond in reference to those that are present in each one of our different environments. Where are we at in reference to management and coordination? 11 of the 26 participating countries, or 42% of them, have defined a focal point on a national level to be able to see the prevention and control of drowning. And here we are able to identify these in green. The majority of these focus points are included in areas focused on the reduction of disaster risk in Chile and Colombia. They are included in the Coast Guard. In Mexico and Jamaica, it's part of the work led by the health sector. In red, we have the countries that still do not have any of these focal points to be able to see this very good work. Six countries, however, have a national strategy for the prevention and control of drownings. Here, we are also able to see this in green. Chile and Uruguay make reference to being able to be in process of seeing this in reference to many countries. And then after we collecting this information, we know the interest of being able to have progress in this sense, which what we believe is ideal, and that this can definitely inspire in the countries that are in red and that have not been able to continue having progress towards this. These strategies are led throughout a government agency in Mexico and Panama in reference to the whole society in Cuba and for non-government agencies in this other countries. In the strategies of Canada and Mexico, we have this part in reference to reduction of deaths, and also the strategies of Brazil and Panama have been evaluated. With the exception of Dominica and Belize, in the other countries, you would have different areas that will definitely look towards initiatives of prevention. In the column of the left, we're able to see the number of areas or areas within the countries of the government that promotes these actions, and also non-government organizations that we're able to place here on this right end, which are normally associations of adoptions or of rescues that we will also see here. And also this part normally are able to see here in this end, and these are the coast guards which are represented in the 81% of the countries that are participating, 78% also in these health and this in reference to only in Bahamas, Guatemala, Honduras, and Panama. The health sector does not participate in concrete actions, which we believe could be an area of opportunity in these sectors. And while 7 countries that I will highlight in green have been seen here by a normal mechanism of coordination, which can be included in the country and non-governmental organizations, which also have Cuba and different where different ends are being able to coordinate it seen here. These are key to be able to make strategic decisions. And although 14 countries recollect vital statistics in a continuous manner or a national end, then also only 5 countries that I'm here seeing in green have data that are able to see different variables such as age, sex, type of a water body where the drowning occurred, and the activity at the moment of the occurrence, standards that we consider to be minimum for an analysis of utility for the prevention of drownings on this end. Additionally, Brazil reported a recollection of information in the community that can help towards the learning of these kinds of ends, which have not been seen in other countries. 38% of these participants are able to see have different awareness campaigns in reference to the risk of drowning. Here I'm putting here one of the countries, 42% in our specific campaigns and national ends from the risk of consuming alcohol before or during any water activities. 27% of them focus on specific campaigns for the promotion of child supervision close to water bodies. And here we have the legislation and politics. And here we see how we do this. And here we have the legislation in reference to the perimetering of pools, which is if it's done at a national level, if this can be seen in the 5 countries that are here in green, and also here in reference to being able to be seen this here in different cases such as Bermuda, the United States, and other characteristics in reference to the definition of the altitude, the height, and in reference to being able to see the perimetering of the 4 ends of the pool to be able to have any automatic lock-in systems at the gates. It was also observed that in 7 countries, the policies in reference to reduction of risks sees the prevention of drowning in a specific manner. 24 countries have minimum requirements of marine safety and operations for the boarding of passengers. 17 countries have national legislation for the use of life vests and also the regulation of selling and consumption of alcohol close to water bodies. And finally, what is the progress in the implementation of these interventions, community interventions? Here we have 3 key interventions that prevent drowning in child populations. The installation of physical barriers, which is only applied at a national level in 6 countries that I'm putting here in green. Uh, Swimming lessons established in schools, which is the case of only 2 countries, and the supervised child care, which has had progress in 4 countries that we are able to see here now. And also reduction for the use for the reduction of risk in reference to navigation, or we were able to see that many countries have been able to have an increase that we have more green ones and more actions in reference to public security, in reference to the presence of a safeguarding team, and also having certified staff and training programs for first responders, which are public in 7 countries. And we have different opportunities that are clear and that are presented to be able to have progress on this end. The first opportunity that we have, I believe, is that drownings can be prevented. And this is something that is important to mention. There is a group of interventions that have shown to be effective when implemented in an independent manner, but that even apply have a greater potential that is more preventive. And here, just to let you know in a more graphic manner on the right end, what are the interventions that can be grouped, let's say, in 8 verbs: communicate, supervise, protect, swim, train, rescue, implement, and integrate. And for this, we have tools that the WHO has developed to be able to have them be implemented in the countries. And my colleague Caroline will be speaking about this in a little bit more detail. I will not stop here, but just to be able to emphasize that these tools are now available and they can be used in the different regional contexts. And many countries have actually been able to have progress. Here we will be able to hear the experience in reference to Brazil and Mexico. But the countries that are represented here are countries that participated in the opening call and invite that we made last year to be able to support actions, local actions of diffusion in reference to the launching of the World Report, the Global Report. And this joint work between PAHO and WHO in the countries to being able to see non-government entities that can continue, that can be reinforced in these contexts. And we actually have the potential of inspiring other contexts in this work when this is not yet beginning. But I do believe that the opportunity of creating local synergies is present there, and it's just a matter of having a dialogue. Another opportunity that we have is the possibility of participating in the public consultation that was open on July 25th and that will be closed on September 15th this year. And here we have the participation to be able to develop a world strategy for the prevention of drowning in 2025-2035 that we are going to be leading. And a way of doing this is by answering a brief survey of 10 minutes. And I will put here the QR code so you can see here whoever wants to participate, you can do it quickly and easy. Another thing is about incorporating specifications in the PDF document in reference to the role strategy that has also a QR code that can be included here. And it can also be showed in reference to what I'm placing here. Thank you very much for all the feedback that you're providing in these 2 ways of participation that we believe is going to definitely enrich all of the work that is being developed. And with this, I would like to conclude this presentation. I think it is important to be able to see that this report was possible due to the involvement of many people from different areas. Considering the strategies provided in the different countries in the world and also from the financial support that this was given in the World Health Organization. But I would like to specifically thank Alexander Sanisa for the coordination throughout the recollection of data and the analysis of this information. Thank you very much, Alexandra. And we appreciate the work that you're doing. And also with Caroline, to Caroline for leading this work at a global level and to be able to being able to see our analysis. And well, at the end of the day, I am presenting the results of the effort and commitment of many people. And that is why I would like to thank them and your authorities, of course, for giving us everything that was needed to be able to have progress on this end. And with this, I would like to thank you all for your attention. And we are here, of course, waiting to see how we can help in this very important work for the countries in the region in order to be able to have a world without deaths due to drownings. Thank you very much. Thank you very much, Ricardo, for having a clear vision regarding the progress and opportunities for the region. And now we have the experience of Brazil in reference presented by David Spillman and from the organization of Sobrasa. Thank you very much, David. Go right ahead.
Thank you for the invitation. It's a pleasure to be here with you guys and show a little bit of what we've been doing in Brazil on drowning prevention. I have a drowning event when I was 7 years old, and this impacted my life. And I start to swim. I start to learn how to swim, and then I get in a university as a medical doctor, and I made all the university swimming, and with the sponsorship about swimming. And when I graduate, I understood that something should be done in Brazil about drowning. And we found the Brazilian Life Saving Society, Sobrasa, and this has been 30 years. And what I will show you is a little bit of what we've been doing. So Brazil is a long coastline with the highest number of rescue worldwide. The temperature is great, but one Brazilian dies every 9 minutes. It is 16 Brazilian every day. Drowning is the second leading cause of death age 1 to 4 years old. Every day, one child dies by drowning at home. Children more than 10 years old and adults die more in natural waters than on the beach or in the other venues. Every year, we try to understand who is drowning, how, when, why, where. And every year, we publish a drowning epidemiologic book so we can understand exactly what is the problem, and so we can snipe the target very well. So we evaluate scenarios, activities, and age range, understanding that different scenarios, different activities, and different age are different problems which needs different solutions. And this is a Brazilian map that shows in red and in yellow where is exactly the most biggest problem of ours of drowning. So it's not exactly on the beach, it's exactly in rivers, lakes, dams inside the country. So how do we see the problem? We see that prevention is most important tool. It's the most important action that you can do or you can make. But how does society view the problem? They always sees it as the first aid or a rescue. Everyone in society wants to learn how to rescue or how to give first aid. And this is an important thing, how science sees the problem. And we see is in this publication in Resuscitation a few years ago, we have fortunately to show how important is prevention for this disease that we call drowning. So 99.9% of all actions on the beach by lifeguard is prevention. Only 0.1% is rescue, and only 0.02% is first aid or advanced care. Brazil has more than 15,000 full-time lifeguards. Lifeguard supervision is limited to 30% of aquatic areas. So we have 70% of our areas uncovered or unsupervised. How we can deal with that? And we know that 76% of that occur in rivers, lakes, and dams. So we estimate that the risk of death by drowning in an area without lifeguard is 60 times greater. So people are getting drowning and death on rivers and lakes, areas that they have no lifeguard supervision. More than 90% of that occur due to ignorance of the risks, failure to respect personal limitation, and a knowledge of how to act. So prevention, we know, it's the best attitude. Alessandra, can you play the video?
Johanna, I think that she will be sharing, right, Johanna, the video?
Sí, ya lo voy a presentar.
Okay, yeah. Can you unshare your screen, David, so Johanna can share hers? There you go.
Thank you, Johanna. It's okay. Let me capture again. So what this video is showing is that there is a huge barrier between knowing the problem and having the tools to prevent. This barrier is when the society does not believe that the drowning can happen. So we found the Subrasa 30 years ago, and with one mission to unite Brazil to reduce drowning. And now we are 8,200 volunteers around the country doing 17 prevention action every day. And this is a menu of prevention programs. We have 18 prevention. Sorry. Is that any problem, Johanna?
No. Go ahead. Sorry.
Oh, sorry. We have 18 prevention programs. The above programs is to children at the school, at the pool, at the beach. And then we have Surf Safe for surfers. We have the basic life support on drowning for athletes, swimmers, and canoe and other sports. And then we have first aid, all targeting educate not to drown. We believe that if the society is well educated to avoid drowning, knowing the risk and how to behave, this will be the cure of a drowning situation in Brazil. And then we have the multi-prevention programs. The county more resilient on drowning, which affects rivers and inside the country, and life save clubs. And then we have 4 prevention campaigns: the World Drowning Prevention Day, the Pool More Safety Campaign, the Latino America Prevention Week, and the retrospective after the 1 year its end. Let's see if this is. I can play. This is the video that we play for cartoon. Is in English. It has some sound, but I know you're not listening. But the important thing is we have to thank you a lot.
July 25th is the World Drop.
We want to thank you a lot, the World Health Organization, because there has been a very good thing for us to have the World Drowning Prevention Day. It causes awareness. It gather every organization united in the country. And this is something, the tools that we use for drowning prevention, the cartoon videos, the comic book, mask, and many tattoos and pumpets and everything we have in the hands we use for educate children in Brazil. And we also do a national life-saving championship, which gather all the lifeguards on the country. And we do believe prevention action involving need to involve the entire society, from the very young to the oldest one, to prevent the avoidable, a child drowning after everyone goes to sleep in a Sunday day, in a barbecue. And this is an avoidable thing, and we have to fight this thing. Thank you.
Muchas gracias a David por la presentación y por darnos la experiencia de Brasil.
Thank you very much, David, for your presentation about Brazil's experience, and we will now continue with René Castillo, who will tell us about Mexico's approach to this problem.
No te escuchamos, René. Creo que tu
We
micrófono.
can't hear you, René. I suppose your mic is off.
Buen día a todos.
Good
Muchas
morning,
gracias a
everybody.
todos
Thank
por,
you,
pues,
everybody,
compartirnos sus experiencias y para mí
for
pues
sharing your
realmente es un honor
experiences.
presentarles cómo México ha
Today,
logrado
I'm honored
disminuir
to
su
present
tasa de
how
mortalidad
Mexico
por
was able
ahogamientos
to
y las
reduce
distintas
its
acciones que
rate
ha
of
implementado para
drowning
alcanzar este resultado tan
cases
positivo y
and what we did
satisfactorio.
to achieve this positive
En
and
primera instancia,
satisfactory result.
pues
In the
les diré
first
que, bueno,
instance, I would like to tell you that
recientemente tenemos que en el 2012 la
in
Organización Mundial de la Salud
2012, the
estimó
WHO
definitivamente
estimated
en más de 3.5 millones
more
de
than
fallecidos por estas
3.5
interacciones. Entre muchas
million
de estas,
deaths
las
because of
lesiones de entrenamientos
accidental
significaban
accidents,
372.000.
and 372,000 of these
La tasa
were
más alta se
drowning
presentaba
cases.
en menores de
The
7
highest
años,
mortality
siendo
rate was in
8.6 en
children
niños
below
y
five years of age, 8.6
8.4 en niños por cada
in
100.000 habitantes. En
girls
México,
and
en enero del
11.4
2012,
in
al
boys
2013,
for
desgraciadamente,
each
fallecieron
100,000 inhabitants.
34.097
During the
personas
period
por este
from
tipo de
2000
accidentes en
and
los adultos.
2000 to
Y en lugares que se
2013,
habían identificado en otro México con
34,000,
mayor
more
incidencia
than
eran los depósitos de
34,000
agua, los
persons
parques
drowned in
para
Mexico.
incendios y los lugares
And
más
the
lamentables como eran
places
ríos,
where these drownings
playas,
happened were mainly
lagos.
tanks
En este contexto,
to
la
fight
Secretaría de Salud en
um,
México, a través
fire,
del Secretariado de
the
Prevención de
fires,
Accidentes
and
y CTFONAPA,
also
estableció un grupo de trabajo
uh,
de prevención de accidentes en lugares
pools,
vulnerables,
for
en el cual
example.
se
And
trabajó
so the
con salud
Health
pública
Secretariat in
para denominar un
Mexico
modelo
established
integral para la prevención de
accident
accidentes en
prevention
mar,
in
el
vulnerable
cual es un
groups
modelo que brinda un
model.
enfoque de salud pública
And
que toma como
this uses
referencia
a public
evidencias
health
nacionales e
focus, taking as a
internacionales de las
reference
acciones que se han
national and
demostrado
international evidence
poderlas
of
aplicar ya que
actions
habían sido
so
efectivas en
that
la prevención y
they
en el control
that
de
have been
múltiples tipos de
efficient and
lesiones.
effective
De
for the
ello
prevention
deriva que
and
se aplica
control
también como
of
modelo
different
para la
types of
prevención de ahogamientos en
accidental
grupos vulnerables de niños.
injuries. And we created the
¿Qué es
model
este
for
modelo de
prevention of
prevención
accidents, a
de
comprehensive model for
accidentes?
prevention of
El
accidents in
modelo, para poderlo
Mexico.
entender,
This model, so
tenemos
that
que
we
ver
can understand
que
it,
son acciones de manera
includes
coordinada que se
specific
llevan
interventions
interdisciplinaria.
at
Es
a
decir, la
multisectoral,
participación activa de todos los
interdisciplinary
actores e instituciones de la
coordination
sociedad
level.
para tener una visión integral
So
del problema,
we want to have a
prevenciones,
comprehensive
esto
view
también
of the
aplicado a
problems.
los distintos
This
tipos de
is
lesiones y en
applied to the
particular
different kinds
ahogamientos.
of
Además,
injuries and
consideramos
especially also drowning
cinco
cases.
estrategias
We consider
que son
5
primordiales. La
strategies that are really
primera es
very
contar con la
important. The
información, es
first
decir,
one is to
información que
have
permita entender la
information,
magnitud y alcance de la
quality
problemática que
information
estamos
about
viendo.
the
En
problem
segundo
we
lugar,
are
revisar y
focusing on.
mejorar el marco
The
normativo, es
second
decir,
one is to
revisar las
review
leyes
and
mexicanas,
improve the
en este caso las normas
regulations.
oficiales
In
mexicanas,
this
para
case, the
poder
official
adoptar alternativas
Mexican
diferentes de regular y tomar
legislation and
decisiones en materia de
regulations
prevención de
that
lesiones.
allow us to
En
make
tercer lugar,
decisions
revisar
and,
inspecciones de seguridad
for
laboral y
prevention.
comunitario.
And then we have
Debemos
safety
realizar visitas a los
inspections,
sitios
and
donde
that's a
se están identificando
community
los riesgos,
approach
principalmente donde ocurre la mayor parte de las
because it
lesiones.
leads to
También se implementó un
identification
programa
of places
nacional de
that present
capacitación,
risks. And we
identificando las
started
necesidades que
a
se tenían de
national
capacitación para
training
afrontar los
program
esfuerzos de los grupos
in
poblacionales
order
donde se estaba
to
viendo
focus on population groups that had a higher incidence of accidents. And we created social communication tools to communicate these problems that together with a training program provided the first response at community level. And finally, we focus on this first response by also at hospital level. And so we provided a series of guidelines or updated our guidelines for medical care and prevention. So the quality information led us to identify the vulnerable population groups, such as, for example, children, teenagers, and the elderly, in order to identify also the situations that led to drowning cases. We have reports on cases and activities that allow us to identify what is happening and what has been happening, and this provides us with a follow-up data and the possibility to improve our response at all levels, the local, state, and national level. And with it, visits and inspections in order to identify risk factors in different environments, for example, homes, working with people, talking to them. We inspected, for example, also nurseries and homes for the elderly, and we added also courses and also presentations with suggestions for preventive measures, so that took them into account and they take them into account. And we also implemented a training program at national level where the competences of all people were rated, and unfortunately this happens in beaches, also pools, etc., which are locations, leisure activity locations. And so we tried a horizontal, we set about to implement a horizontal approach and a transversal approach. And so we implemented training courses at regional level. And so we now have 1,100 people that are specialized in drowning rescues. And we are also raising the awareness of the population through several activities, and this gave us as a result a reduction of drowning cases, such as, for example, we have a museum, that in an ambulance that goes from place to place, that tells them about the prevention measures, and we also organize courses for schools. We also talk to the elderly and in order to take care when nearing a water body. And we also trained the healthcare staff about prevention measures in case of drowning cases. And all this led us also to social communication measures. We set up different strategies. One of them was the publication of a book that is called life stories. For example, people that have lost a family member or have suffered a traumatic event because of a um, drowning case. And also at community level. And we also set up campaigns of communication that were entitled Prevention is Vital. We did this in transport means and buses, etc., in on uh, trucks. We distributed materials in a physical way, and while physically we did this at hotels and vacation camps, and we also used the social media, such as social network. These messages were directed to prevention mainly. For example, to put fences around water storage areas and to prevent water activities or after drinking alcohol and many other activities that lead to the prevention of to prevention of drowning cases. And we did this in a scale, well, in a supplementary way. And this has allowed us to reduce the number of deaths a long time. Well, it took us a long time. From 2012 to 2023, we've did a follow-up of the rate, and we can see that it has gone down from 1.80 to almost 1.20. And these activities were implemented in a gradual way. First of all, in 2015, we set up the work group we mentioned, and this group developed the comprehensive means for accident prevention. And we also published the life stories and many graphic materials that led us to raise the awareness of the population. And we also did trainings through the Secretariat of the National Marine Corps, uh, and since 2014, we have worked permanently in actions for awareness raising and publications, diverse publications, and about profiles and prevention campaigns. And this has led us to reduce the rate from 1.8 in 2012 to 1.25 in 2023. So it was a reduction of 0.58%, and that's a significant rate because we have reduced it in especially among the vulnerable population, that is the elderly, children, and teenagers. And we have gone to swimming pools and beaches and rivers and lakes to promote these measures because we don't want people to lose their lives because of drowning. The prevention of accidents has showed us to be a very efficient tool through several strategies, and we have seen the results because we have developed coordinated plans that include preventive actions and training courses for professionals and first help volunteers. And we have talked to the population and we have created a culture of self-care in children, teenagers, and the elderly. And Through these different means, we have been able to multiply the messages reaching the whole of society about this problem, and we have raised awareness about the danger of aquatic activities or near the water storage facilities. And we have talked to all the authorities at all levels because in this way we have provided a comprehensive approach. And we have delivered messages that are kept updated. And this way we have reduced the morbidity and mortality rate. Obviously, this has been group work. It has involved many people along many months and years, and I'm just talking about the achievements of all these people. These are some of those who have intervened to achieve these results and have helped implementing the model, and they have been with us in they have been helped us in death prevention by drowning and also by accidents on the road. And all the institutions and authorities, both federal and at state level, and also the state authorities for accident prevention have helped us to implement actions and interventions that have allowed us to reduce this rate by drowning, mortality rate by drowning. And here you can see some of them that have helped us. They have been fundamental in helping us developing and applying this strategy. This is all I wanted to tell you. Here on the screen, you will find the code that will lead us to our webpage about our comprehensive strategy for accident prevention and mainly about drowning prevention. We still have a road ahead, but we are making steady progress. We thank you very much in the name also of our authorities. Thank you very much, Renee, for your presentation and the commitment of Mexico in preventing drowning cases. And now I invite Caroline Lukasik from WHO to share her ideas about our.
Thank you very much, Alessandra. I will just share my screen. And good morning, good afternoon, everyone. It's my absolute pleasure to be here with you today to share some really helpful tools that the World Health Organization has developed over the past 10, 11 years for drowning prevention, and to give you a preview of some upcoming tools that may be helpful for your work. So as you can see here, a couple of these covers will look familiar to you. Ricardo, my colleague, has introduced these at a very high level at the beginning of the presentation, but I will provide a little bit more depth on what they are, what they contain, and how they can be used, as well as sharing with you, again, some very exciting upcoming items that we have planned. So I'll start with our past resources. And the very first resource I need to mention and acknowledge is, of course, the Global Report on Drowning. And I did see Dr. Castillo had mentioned this in his presentation as well. This report was launched by the World Health Organization in 2014. And this is the first ever report specifically focused on drowning released by any UN agency. So we call this internally a milestone landmark report. And half of this report was very much focused on demonstrating the burden of drowning, demonstrating the various risk factors for drowning, and highlighting that drowning actually occurs primarily in lower middle income countries. The other section of this report that was very important are these 10 WHO recommended interventions for drowning prevention. 6 of them are really focused around the community, And 4 of these are more cross-cutting governmental strategies to help develop these environments that really promote and support drowning prevention interventions being implemented at community level. And we've been very, very lucky today to hear from Brazil and from Mexico on how these interventions are actually being operationalized, scaled up, and integrated into national planning and strategies. So it's really fantastic to hear that amazing progress. But this resource is very good as an entrance point to drowning prevention. It's a very good advocacy tool, and it really presents the issue in a simple, straightforward way with appropriate scope for the complexity of it. Once this report was published, we received a lot of excellent feedback on it, but people wanted more detail. You can see the interventions. One example here is around teaching school-age children swimming and water safety skills. And we had requests on how can we do this effectively and how can we do this safely in communities. So working really closely with our community organizations and governments around the World Health Organization developed a subsequent resource in 2017, which is the Drowning Prevention Implementation Guide. And this guide takes those 10 WHO recommendations and provides a lot more detail on how to actually operationalize these and how to actually implement these. I've taken that example of teaching school-age children swimming and water safety skills again and giving you an idea of the subheadings underneath this chapter. So we now provide more guidance on assessing the situation and assessing the needs of communities, on defining target populations to approach with this type of training, selecting an appropriate site to deliver the training, selecting and training instructors appropriately, and engaging the parents of children. So again, this is just one example of the swimming and water safety recommendation, but you can see this level of detail is getting much more granular and much more practical as well. We published this again in 2017, and we learnt from, again, our partners working in communities and partners working in countries that more information was actually needed. There were a number of unknown areas, a number of grey areas that people weren't entirely sure what the right decision was to be able to, again, implement these recommendations really effectively and safely. And this is the final implementation guidance WHO has developed, published in 2022. And this guidance is focused on 3 specific interventions only. It's guidance for the provision of daycare for young children, for basic swimming and water safety skills, and for safe rescue and resuscitation training. So just 3 recommendations are captured in this guidance. Again, I've taken the example of teaching school-age children swimming and water safety skills and just given you a very high-level snapshot of the level of guidance that's actually available in this document. We are now talking about targeting a specific age group, living in specific areas, rural communities. There's information in detail about how to screen children for medical conditions of disability, which may impact the participation in water safety skills training. We give guidance on how to get consent for children to participate in the safe swim training, performing safety assessments on the water bodies used for the swim training. Again, this is just an example for one intervention. And this guidance is not only excellent for when establishing new programs in the community for drowning prevention, but it's also an excellent tool to check back and evaluate and assess the quality of existing interventions to really, again, make sure that they are safe and that they are effective. This is really around safeguarding and around protection and around ensuring the best, most impactful use of resources towards drowning prevention. So I do very much recommend that these 3 resources, I've attached here URLs, online links. They're all freely available to download. So please do have a look at these resources. My next section of my presentation is focused on new resources for drowning prevention developed by the World Health Organization. This first one here, Ricardo did show it quite briefly on one of his slides, but I wanted to look into a little bit more detail. This is the first ever global investment case developed on drowning prevention. And this is an extremely important tool because it's a fantastic advocacy document. So WHO launched this in 2023, and it has some very nice calculations, some very nice economic data about the benefits of investing in drowning prevention interventions now and what the return of investment will be in the future. So we've used data collected from countries around the world to understand exactly what the financial return is in terms of lives saved, in terms of productivity saved, in terms of GDP saved, by investing into two specific interventions for drowning prevention. And that's teaching basic swimming skills to children and providing daycare to preschool children. So you can see here, this is a very nice infographic that summarizes the key findings. We know that teaching one child to swim costs on average around $17, and providing childcare to preschool children costs around $26. If we make these investments now to increase the coverage of these interventions by 50%, by the year 2050, we'll have saved nearly 800,000 lives of children. We'll have prevented almost 1 million non-fatal drownings among children. And coming down here to the numbers, there's anticipated to be $400 billion in economic benefits, which boils down to a $9 return for every single dollar invested up here upstream. Again, when we speak to policymakers and we talk about the importance of investing money into drowning prevention plans and strategies and programs, this resource provides us with a very powerful argument and empirical data to demonstrate that this investment is definitely worth it. Again, this is another way the data is presented in this report. We're seeing here the cumulative intervention costs, which is the blue bar, versus the economic benefits of investing into these two drowning prevention interventions over time. And again, the exponential increase of the benefits and how much it outweighs the cost is really quite striking. Another tool that Ricardo spoke about in some detail at the regional level was this very recently launched Global Status Report on Drowning Prevention, which we published in December last year. Ricardo gave a number of acknowledgements for this report, and I'm going to give a number more. We had 139 countries globally participating in this and submitting national data towards this global situational assessment, which is equivalent to nearly 1,000 individuals around the world convening at the national level to discuss drowning and drowning prevention. This type of effort has never been done before. Ricardo has shared the key findings from the Americas region with you today, but I thought I might now come in and talk about the potential applications of this information. It's a very good starting point for national situational assessments to better understand local drowning risks. And this is national assessments, but also subnational. It's a very useful tool to identify priority interventions. When we assess the risk and we look at where the burden is, we can clearly link and identify what recommended interventions would be most beneficial to address these current issues. It's been a very good tool and continues to be a good tool to identify and engage multisectoral partners in drowning prevention. We know that drowning doesn't sit within one sector. We've heard a lot of different risk factors and many different partners involved in drowning prevention efforts. This global report is a very nice way of identifying, having a starting point to think about who could be invited to be part of these sorts of initiatives. It enables between country comparisons, and we hope that this will lead to knowledge sharing between countries, which is exactly what we're doing on this call today. It's another great advocacy tool. It contains a number of high-level messages, some really powerful facts and statistics that can be shared to policymakers, that can be shared with community through awareness-raising campaigns and advocacy campaigns to, again, really highlight the burden and impacts of drowning and to promote evidence-based, proven solutions for drowning prevention. The final dot point here is a really, really important one. It's around monitoring and evaluation of progress over time. And at WHO, we plan to repeat this situational assessment in full in around 4 or 5 years. And the point of this is to track where countries have made progress and where gaps remain. So that will signal to us where additional support, resources, expertise is required for us to be able to reduce drowning deaths uniformly and equitably across the globe. Again, Ricardo has shared your region-specific outcomes with you from this data collection exercise. Here I have the global outcomes, if you were interested to see them. The percentages you see on this figure here are of the 139 countries participating in this exercise globally. This is the percentage of countries that had national coverage of these various drowning prevention interventions. So some interventions had extremely low coverage. We saw legislation for swimming pool fencing. Only 14% of countries globally had this legislation, while other interventions have very good coverage. One example here is free weather alerts. 81% of countries globally had national programs that provided free weather alerts to warn people of floods, storms, tsunamis, or any other types of situations where people could be exposed to hazardous water very suddenly. So again, we plan to repeat this in 4 or 5 years' time and see whether or not these numbers change, which directions they shift in, and that will really help us establish our agenda moving forward. The last section of my presentation looks at upcoming resources. The first one I'm very excited to share, and I know Ricardo's also shared this as well, was the first global strategy for drowning prevention, which is being developed by the Global Alliance for Drowning Prevention, hosted by the WHO. Ricardo's given a very nice overview of the key components of this, and I just wanted to take the opportunity to remind everyone that this is open for public consultation. We would greatly value your inputs, your thoughts into what we've drafted so far. This is really a strategy for the global drowning prevention community. The purpose behind this is to unite the global drowning prevention community on a common agenda with common targets, with common aims, so we can all work together, so we prevent overlapping in efforts, we prevent misuse of resources. We're really focused, aligned, and most importantly, we're making the most of our expertise, of our knowledge, of our reach, because this community is extremely impressive and this community has extremely diverse knowledge and talents. So again, having this centralized strategy is one way to bring us all together around a common set of goals and a common set of messages. The last 2 technical products I'll share today are currently under development, and they'll be launched on World Drowning Prevention Day, so that's the 25th of July next year. The first one is a technical package for drowning prevention. The World Health Organization develops technical packages for a wide variety of public health issues. We have technical packages for alcohol harm reduction, for preventing violence against children, for preventing tobacco use. This one will be specifically focused on drowning prevention, and it'll be really focused at the policymaker level. It'll provide guidance on how to establish effective policy and legislation, which creates environments that support water safety and drowning prevention. It's going to be very much sector specific and very, very much multisectoral, which has been a very big challenge that we've had so far with creating this resource. We've really pulled out and reached out to many different diverse stakeholders and partners to get a better understanding on really effective and plausible interventions for water safety. You can see here there'll be components of this focused on child protection, on maritime transport safety, on occupational safety for water-based employment, such as fisher people or people who work in shipping or boating or water transport, risk reduction during flooding and other natural disasters, safety services on and around water, including lifeguarding systems, including also search and rescue systems, and then safety infrastructure in and around water. And this can include from rural areas to urban centres that have water bodies within city landscapes. And how do we make sure that people can still have exposure and enjoy the water, however, do it safely? So this is a very interesting resource that we are currently heavily and deeply involved in. So please do keep your eyes on this, and we'll be launching it next year. At the same time, on the very same day, we have a second resource we'll be launching. At WHO, of course, we've been working so closely with countries, as I've mentioned before, and partners to understand whether or not our guidance is appropriate, whether it's helpful. And through these consultations and partnerships, we always hear about excellent stories, like we've heard from Brazil and Mexico today, on countries that have achieved incredible outcomes in drowning prevention. And the stories are not straightforward. They're complex stories. There are challenges. There are barriers that are overcome. There are facilitators that have been discovered that have driven efforts forward. And this story is just as important as the outcome itself to share, so other countries and other communities can replicate this in their own settings. And so this new resource that we're proposing will document these stories, will document the process, the implementation process, the challenges, the facilitators that countries have experienced towards having success in national drowning prevention efforts. And we're going to try and identify similarities between countries. So hopefully there will be factors that have worked in a number of different settings that other countries can then try and replicate themselves to hopefully have the same successful outcomes. So again, do keep an eye on this. We will be launching this in World Drowning Prevention Day next year. My very final slide is actually about World Drowning Prevention Day, and I know many of people on the call today are very familiar with this event. We celebrate this on the 25th of July every year, and this year was our 5th World Drowning Prevention Day. This is an excellent, again, advocacy opportunity. It's a fantastic opportunity to spread awareness on the importance of drowning prevention, spread awareness on the effectiveness of drowning prevention strategies and programs. And this year, our campaign was focused around Your Story Can Save a Life, drowning prevention through shared experiences. And it really captured, again, the work being done by countries. You can see Brazil is featured here on our campaign page around really practical but effective activities for drowning prevention. So again, World Drowning Prevention next year, 2026, will be the 25th of July. We'll be working on our campaign from now until then. So please do make sure you keep a look on the WHO campaigns page, and we will upload information as available. But we do really encourage everyone to take part in this. It's becoming bigger and bigger every year. We ask countries to submit videos from their World Drowning Prevention Day celebrations each year. And this year, I think I received around 300 or 400 emails. So it's really growing so much in momentum, which is very exciting to see. So I'll finish up here. Thank you very much for your attention. And please do let me know if you have any questions, either in the comments or if we have some space for questions later. But thank you so much, Alessandra. Thank you.
Perfect. Thank you so much, Caroline, for your presentation and for giving us all the resources that WHO provides. Now, para cerrar la ronda de
To
presentación,
close the presentation round, which we will have now, in reference to being able to share from Steve Irvin, the Vice President of the Real Society of the Water Safety and Commonwealth, that will share reflections of how we are able to carry out different actions in this environment.
Thank you very much, Alessandra, and I'm just setting up the opening of the slide. I'm assuming that that is seen appropriately.
Yes, we can see it. Thank you.
First, thank you for the opportunity to participate in this event with you, and my apologies for not having adequate Spanish to speak to you in Spanish. And at that point, I'd like to thank Alessandra for setting this up, but also to the translators who are working in the background to help us understand each other and share the information. So thanks very much. I wanted to talk about accelerating actions on drowning prevention in the Commonwealth countries, and I am the Deputy Commonwealth President of the Royal Lifesaving Society, Commonwealth-wide organization. There are 56 countries globally in the Commonwealth of Nations, and there's 12 of those in Latin America and the Caribbean. And so I thought we would try and focus a little bit on some of the issues associated with that and the challenges we have in addressing drowning prevention in that context. These were the key messages that I will show now and repeat again. There's a link at the bottom for a fact sheet that you may find useful. The fact sheet I will speak about, which is the RLSS Commonwealth's Fatal Drowning Fact Sheet, Issue 2. This is the second time we've done this, where we actually look at the fatal drownings within Commonwealth countries and aggregate them into the regions. And so Latin America or Americas, Latin America and the Caribbean are one of those regions. Key messages would be that throughout the Commonwealth, not unlike many other regions in the world, fatal and non-fatal drowning data is not at a mature level of collection or utilization. And we have some growth to do there. So there are many countries in this region, in the Latin America and Caribbean region, where there is few data collection vehicles and that they're incomplete. So we'll get a source of data from the police or from a military source or from a civil organization, but it will not be complete. And so therefore we don't have a full understanding of the fatal drowning picture in that country. And that's a typical challenge in many of our Latin American and Caribbean countries. And so therefore it's difficult to utilize that information to inform preventative action. Number two key point is that government engagement is wanting. So we know that government support is an accelerator, and in most Latin American and Caribbean countries, the governments are not engaged in the broad distribution of information and programs and training in drowning prevention. And so more government engagement would be helpful. The third would be a public health approach is needed, meaning we need to be looking not just at the burden, but the inequities within that burden. And often programs that aren't public health approach in focus are dealing with the population that actually need the intervention the least. And so the public health approach would be directing the interventions to the populations at highest risk who need it the most. And the final sort of key feature that I wanted to point out was that we need to focus on reach, inclusion, and impact. And the focus is often elsewhere. The focus is often on one particular subsector or one small urban area of a country or a region, when the bigger problem is actually in the rural aspects, rural locations. So those would be the key messages that I wanted to focus on. I think it came out of presentation mode. Am I right?
I can still see your presentation.
Okay, good. This is the Commonwealth-wide fatal drowning data sheet. And Commonwealth-wide, there's 121,000 people die from drowning each year, which is 4.7 per 100,000. This is not just your region, but all of the regions of the Commonwealth. We have 40% of the global drowning deaths, with just under 32% of the global population. So we're disproportionately represented in global fatal drowning. And approximately 2/3 are male, which is pretty consistent across all regions. 54% of the drowning in the Commonwealth countries is occurring in people under the age of 14, and 34% are under the age of 5. So this, sorry, I'm into a report and not into the PowerPoint. So I need to stop sharing and reload the share. My apologies. Okay.
We are in the key messages for accelerating action.
Yeah.
Is that the one that you want to show?
Yeah, I'm trying to advance the slide.
It doesn't allow you to advance. There you go. I can see. I can see.
I think I got that one now. Okay, this is the breakdown in rate. So fatal drowning rates per region in the Commonwealth. And you can see that the Caribbean and the Americas region is at 1.5 relative to the other global regions of the world. This is the rates in age categorization in the Caribbean and the Americas region. And so the greatest is in the youngest population. This should be one of the areas that would inform our targeting. Here are the countries. There are 12 Commonwealth countries in this region. This is both the absolute number of fatal drownings and the rate of fatal drownings. And again, there's some countries here who show very highly in the rates, who we need to focus as a region on the drowning issue in those locations. So the challenges in facilitating acceleration of action, the first challenge is that in the case of the Royal Life Saving Society, or the Commonwealth body, we only have 5 of the 12 members are members. And we have engagement in all of the countries. We don't have official participation in the majority of them. And in some where we do have official engagement, the engagement is shallow, very focused. It may just be focused on lifeguard training or just focused on CPR training, and not the broader concept of drowning prevention, which would include community action, policy and regulation, and research that would inform intervention. The second challenge is that data and the drowning focal point agencies are often weak or sometimes absent. We saw the identification of focal point agencies within countries in previous slides in this webinar is weak. And so we have lots of upside work to do to encourage sectors of our population to engage in the data collection. So in some cases, data collection is best done by government in terms of vital statistics. In other cases, the government has an immature or non-existent vital data collection system, in which case it's better done by a focal point agency or an NGO, or a collaboration that would be multifocal. Third would be that there's weak or no government engagement in many Commonwealth countries in the Latin America and Caribbean region. And there's some great upside potential. And some of the documentation that was presented by Carolyn around return on investment, we need to get that kind of information to government decision makers so that we can improve the engagement of people who have the capacity to resource and also facilitate. And so we have great opportunity to engage more government in the issue. There needs to be a broader reach. So the reach is often in Latin American and Caribbean countries. It is focused on a coastline or a swimming pool setting, or it's focused on lifeguard training, and not the broader reach of how do we address the fact that the majority of people who drown in Latin America and the Caribbean are children that are very young. So how do we reach that? How do we deliver the messages of adult supervision or guardian supervision to the people under the age of 6? How do we introduce daycare and other supervisory strategies that are broad and are community-based, but they do more than prevent drowning. They actually prevent other injuries as well as provide early childhood development milestone improvements that are helpful. How do we get the basic swim skill training into school systems so that it becomes inclusive? In many Caribbean countries and Latin American countries, the wealthier population or the higher income population can get swim skill training, and the lower income population is often unable to achieve that. And so we need to be inclusive. We need to do this in a way that is public health based so that it can actually reach to everybody, and especially those who need it the most. And that includes our rural communities, who tend to be underserved in the non-public health model. So focusing targeted interventional programs on the highest risk communities is needed, and this needs a broad community reach. And the fifth challenge that I wanted to speak about was the lack of urgency associated with drowning prevention. It's challenging to elevate the broader community and government and other multisectoral stakeholders into the urgency with which this has. Nobody should be drowning. This is highly preventable. We need to connect the narrative stories with the data and the capacity to improve that opportunity. So those would be the challenges. The opportunities and the potential avenues for collaboration to advance and accelerate drowning prevention are, one would be multisectoral coalitions for drowning prevention. So there has been some great successes with multisectoral coalitions in this region, the Latin American and American regions, and those coalitions are at the community level, the regional level, and at the national level. And it focuses very much on inclusion, diversity, and equity. In other words, targeting interventions to the populations that need it the most. And they include inside that multi-sectoral collaboration would be representatives from government at multiple levels, academia or universities, the health sector, the education sector, the communication systems, industry, the disaster community, and other UN agencies and efforts that are going on in climate change, for example, should be engaged in these multi-sectoral collaborations to have the greatest impact. The second opportunity and potential avenue that we could leverage and utilize to a greater degree would be more effective coordination and leadership for drowning prevention. And that leadership can come from NGOs, from government, from academic leaders with capacity and skills. And I do emphasize the words with capacities and skills. So there needs to be coordination and leadership for community action, for policy and regulation, and for research. And this needs to be resourced so that it can be empowered and be most effective. Whoop. There was a third. There we go. The third is international connection and association, just as we've learned today from the wonderful examples from Brazil and Mexico. Having international connection and associations where we share and learn from each other is really critical. It's very powerful, and it needs to be both at the formal level and at the informal level, and it needs to be done with fantastic respect, mutual respect for each other to build capacity. And it needs to focus on drowning prevention and not on the entities themselves. So not on the international collaboration organizations, but on what we can collectively learn about drowning prevention, because there's so much to learn that we need all the players and all the stakeholders involved. And it's bigger than any one organization or any one effort could undertake on its own. And I wanted to conclude by just saying I do think that this effort, this global drowning prevention effort, and this today we're talking about the region of Latin America and the Caribbean, it's all about the relationships. It's about seeing our colleagues on the list and their pictures on the screen. And when we have the opportunity to meet face to face, that we do that, because this is an amazing learning journey. And we are all learning how to do this better. There are no rivals. Or there's no space for competition here. We need to be collaborating, which is hard. It's hard work, and we need to do this better, and we need to learn more from each other, because there's such fantastic and great examples around our region and around the world that can help us learn this more effectively and allow our reach to be more effective and to be have more impact. We need to be embracing the concept that we all need to invest in each other's success, whether you're working on this effort at the WHO level or whether you're working at the community level. We all need each other, and we all need to help each other be successful. So back to the key messages. We need to improve our data, both fatal and non-fatal, and how it's used to inform drowning prevention. We need more government engagement because it's an accelerator. We need a public health approach so that it's focused on the individuals with greatest need who are drowning the most. And that doesn't always happen when you use a recreational approach or a purely educational approach. We need to be looking at not just the burden, but the inequities within the burden. And we need to focus on reach, inclusion, and impact. Again, the link at the bottom is for the fact sheet that was created by the Royal Lifesaving Society Commonwealth to address the fatal drowning issue within its member countries. And I thank you for this opportunity to share this. And again, look forward to interacting with any or all of you if that would be helpful. Thank you.
Thank you so much, Steve. Nuevamente quisiera agradecer a todos los ponentes y para concluir este
I would
seminario
like to
cedo la
thank
palabra a
all
Ricardo, quien nos
the
dará las palabras de cierre
presenters,
y
and
también
I will
aprovechar para
leave the
recomiendo
floor now
los
to
links donde
Ricardo,
pueden acceder a
who
los
will
materiales.
close this
Muchas gracias.
meeting, and then I will also put on the screen the
Muchas
links
gracias,
where you can
Alessandra.
access
Y
all the
quisiera
materials.
agradecer a mis colegas que
Thank you very
generosamente
much, Alessandra. I would
compartieron su
like to
experiencia,
thank
su
my
perspectiva
colleagues
con
that
nosotros.
shared their
Y muy de
experiences with
acuerdo
us.
con el
And
último
I
mensaje que
agree
daba
with the
Dr.
last
Steve en
message
términos de
by Dr.
que en
Steve,
este espacio no nos podemos, en este
because
tema no
in
nos
this
podemos dar el
space
lujo de tratar de
we do not have the
competir.
luxury to compete
Hay
among
un
each
gran
other.
espacio
We
para
have to
sumar
work
esfuerzos.
together. We
Hay
have
una
to
gran
put
oportunidad
our
que se nos
hands together
presenta
to
con todo
use
este movimiento global
the
que se ha
joint
venido
effort
presentando en torno a la prevención de
to
ahogamientos y por
prevent
tanto
drownings.
somos pocos los que
And
estamos interesados,
therefore,
¿verdad? Quisiéramos
well,
que
we're
hubiera
few that are
miles y millones de
really
personas
few
conectadas a
that are
este tipo
interested
de
in this.
eventos
We should involve
sin embargo,
millions of people.
terminamos siendo muy
However,
pocos
we are
los que
very
estamos y
few.
por eso tenemos
And this is
que
why
sumar
we
esfuerzos entre
have
nosotros que
to
estamos interesados en este
convince
tema
others
para avanzar de
to
forma mucho más
join this
efectiva.
effort
Entonces,
in a more
muchísimas
effective
gracias,
way.
Steve y
So
demás
thank you
colegas
very
por todas sus
much, Steve,
reflexiones
and my
y
other
sobre todo
colleagues
a
for
todos
your
ustedes que
reflections,
amablemente nos
and
honraron con
for
su
to all of
presencia.
you who
Muchísimas
were
gracias.
present today
Nos
with us.
estimula mucho ver su
It
interés en este tema.
stimulates a lot.
Estaremos
It's very
satisfechos de sus
very
instrucciones sobre cómo
encouraging to
podemos
see
apoyarles en este importante trabajo que
how
todos tenemos para
enthusiastic you
prevenir
are, and we have
ahogamientos
to
en los
really
distintos
support each
países
other
de la
to
región
prevent drowning
como
among
de
our
forma global.
region and in our
Quisiera
countries, and also at
aprovechar esta
global
oportunidad
level.
para agradecer a las
I would like
autoridades
to profit from this
que hicieron
opportunity
posible
to
este
thank the
trabajo y sobre todo a
authorities
mis
that have
compañeras y
made this
compañeros de la casa, de la
task
OPS,
possible,
que
and my
apoyaron
colleagues
en toda la
from
organización de
PAHO
este
and
seminario virtual.
WHO that
Muchísimas
have
gracias a la
supported us
organización.
in this
Todos
virtual
ustedes
seminar.
son siempre
Thank
un
you very
placer
much for
trabajar
your
con ustedes.
support. It's a great
Y no
pleasure to
menos
work with
importante,
all
ya
of
lo
you.
comentaba
And
Steve,
no less important, as Steve
agradecerle al equipo
said,
de
we will
interpretación que
have
nos
to
ayudó a aprender
thank
la barrera
the
del idioma para que podamos todos
interpretation team that has
comunicarnos,
allowed us to
entendernos
communicate
y buscar oportunidades
beyond
para
language
alcanzar este
barriers
esfuerzo tan
uh,
importante que tenemos frente a
and
nosotros.
face
Excelente
this
resto de
very
día.
important
Sigamos
effort.
trabajando. Hay
Thank you
mucha
very
tarea pendiente,
much.
pero muchas
We have
posibilidades y
to
oportunidades
continue
para avanzar.
working. There's
Gracias
a
a
lot to
todos.
do, but there are many opportunities also. Thank you very much. And thank you for the interpreters also for